Good morning, ladies and gentlemen. Thank you for coming down today to join us for this public forum on common cancers affecting men. Before we begin, please kindly turn off your mobile phones or switch them to silent mode. Please refrain from using flash photography and also kindly turn off any shutter sound as a consideration to others in this room. Thank you. Please also be informed that this forum will be recorded on video and only the speaker will be recorded. Please kindly remain seated throughout the forum. Thank you for your kind consideration. Please remember to complete the evaluation form and hand it to our staff at the door on your left or from the back after the session in exchange for your refreshments. This morning we are very happy to have with us Dr. Ravindran Kanesvaran to share with us on common cancers affecting men. Dr. Ravindran Kanesvaran is a consultant in the Department of Medical Oncology at the National Cancer Centre, Singapore. An assistant professor at Duke NUS Graduate Medical School and clinical senior lecturer at the Yong Lu Lin School of Medicine, National University of Singapore. He is actively involved in graduate medical education and is a core faculty member of the Medical Oncology Senior Residency Program and the SingHealth Internal Medicine Residency Program. Dr. Ravi completed his medical oncology specialty training in the National Cancer Centre, Singapore. He followed up with a fellowship in genitourinary oncology and geriatric oncology in Duke Cancer Institute in North Carolina, USA, on a Healthcare Manpower Development Program scholarship awarded by the Ministry of Health, Singapore. His research interests include GU oncology and geriatric oncology, and he has published in a number of well-known peer-reviewed journals, including Journal of Clinical Oncology and Urology. He has been awarded a number of awards, including the American Society of Clinical Oncology Merit Award 2009, American Association for Cancer Research and Scholar in Training Award 2010, and the European Society of Medical Oncology Fellowship Award 2012. He is currently the president of the Singapore Society of Oncology and the Singapore Geriatric Oncology Society. He is the national representative for Singapore in the International Society of Geriatric Oncology. Despite his busy schedule, he has kindly accepted our invitation to speak to us on this public forum. Let us put our hands together and welcome Dr. Ravi.
Thank you for the kind introduction. So, how is everyone today? All waking up early in the morning to come here for this talk. Are some of you staying for the Mandarin talk as well? Or okay, good. My colleague Dr. To will be talking, and if there are some things that maybe you need explanation in Mandarin, he'll be able to translate and explain to you. So today's talk, both this and the Mandarin one, focuses on cancers affecting men. But I see many females here, so I suppose you all are keen to find out also how to help your husbands and your siblings and people like that, or your parents. So I guess there are many reasons why you will come for a talk like this. For some of you, is it because you all are keen to look at how to prevent cancer? Can I see a raise of hands if you all are here to, or everyone is here to? Okay. And how about knowledge, to know more about diagnosis, treatment, everyone as well? Any other reason to get free consultation? So it's okay, later you can ask me some questions. I'll be happy to answer. So the objectives, first of all, I'll briefly describe to you what cancer is. It can be quite complicated. I'll try to simplify it. And then I'll zoom in straight to focus on the common cancers affecting men. And what are the symptoms? What are cancer screening? I think many of you think about cancer screening as well. There are a lot of commercial entities that promote this, so you must be discerning enough to choose what's useful and important to you and not do just everything, because at the end you end up wasting money and time if you do it wrongly. And some lifestyle advice, what to do in terms of your lifestyle, how to inculcate good habits, and finally some of the latest development in cancer treatment. So it's quite a lot of things. I hope you bear with me. If you sleep, it's okay. I'll try to wake you up. So what is cancer? So I think many of you already know this, but just to explain again, basically normal cells, they grow, they divide, and they die. So normal cells must die, it's a cycle, and then they grow again. And the specific purpose is to replace worn out tissue. So cells make tissue, and after a period of time, tissue get worn out, and then this cell cycle constantly takes place in order to replace the old tissue. However, in cancer, the same cells grow uncontrollably. So you can see here, it just grows and grows and grows, and that is a problem because the body has limited space. So when a thing grows, it becomes a mass or a tumor, and that's what people feel when they press certain parts of their body, or if it's internal, it may cause pain. It presses on some nerve or things like that. So cancer is a growth from abnormal, uncontrolled division of the cells. So normally cells have a fixed cycle, and they grow, they mature, and they die. So cell death is very important, but cancer cells have issues. They either grow too fast, so too many cells, or they don't die, they just stay alive. So because of that, a mass or a tumor develops. So here, this picture shows you how cancer cell division can eventually lead to a tumor being formed. So you can see here how there's a mass there, and because there's some mutation, so I'll explain to you the concept of mutation. Basically, these cells, all these cells have DNA. These are like codes within the cells that tells the cell, this is what you must become, and this is your function. After a while, or because of some change in the environment or genetics, the cells undergo mutation. This cell, the DNA, they change and they give the wrong instructions. So it's like they are being misled and they are told, don't die or grow faster. So because of that, it ends up like this. So cancer stems from that. There are 4 basic stages. The first stage is when the mutation actually happens. So you don't really feel anything very much when the mutation happens. Then when it does, it's first at a microscopic stage. So if you do a CT scan, just simply do a CT scan. If it's at this stage, you won't be able to see it. Although there will be a few million cells there that have mutated and have become cancerous, but they are so small in number, you won't be able to see it. Then you'll only be able to see it when you feel it as a lump. So this is why a lot of people, by the time they get cancer and they come to us, it's late stage, it's not their fault. Even if they scan themselves every day, you wouldn't have picked it up sometimes. Because initially it's all microscopic. It's only when it grows bigger then only you'll know. So finally, of course, it extends into the blood vessel. This blue thing here, this river is like a blood vessel. And these cells get into the bloodstream or the lymphatic system, and they travel to other parts of the body. And then it's terminal stage, stage 4 cancer, where it grows in other parts. So sometimes a lot of people get confused because if let's say they had kidney cancer and later it spreads to the lung. So some people think they have 2 different cancers. It's not true. It's one cancer. It's the same cancer that travels through the highway, which is the bloodstream, and then lodge itself in the lung. So when we do a biopsy, we actually find kidney cancer cells there, the cancerous kidney cancer cells. So they don't have 2 different cancers, it's actually only one type. Okay, now I went through that. There are many different types of cancer. This is another area where sometimes it can be confusing. So cancer is not one type, it's heterogeneous. So let's say even within one organ, kidney cancer for example, there are various kinds of histopathology. That means there are different kinds of cancer cells. That's why it's important for us to know by doing a biopsy. So that will tell us what kind of cancer cell it is. Why? The treatment is different. For certain types of cancer cells, we give certain treatment. So if, let's say you find out you have kidney cancer, you must also find out what specific subtype of kidney cancer, because the treatment can be very, very different from other subtypes. Also, different cancers grow differently. That's why never ever compare. I think a lot of patients, they think very hard, or they ask their friends, and their friends say, oh no, my cancer cured already, go to this doctor. It's not the doctor, it is the cancer. Some cancers are curable, even at the final stage. For example, lymphoma, which is a blood kind of cancer from the lymph nodes. That even in stage 4, you can cure for certain lymphomas. Testicular cancer, which young males to about middle-aged males get. Also, even final stage spread to the brain, spread to the lung can be cured. But if it's lung cancer or pancreatic cancer or colon cancer, if it's spread to the lung or any other parts of the body, stage 4 cannot be cured. So different cancers behave differently. So that's something you need to understand. So when people say, oh, I went for this treatment, just take tablets and I'm cured, it might be a different cancer from what other patients have. So that's something you need to be aware of. There are so many names for cancers depending from the part it originates from. So carcinoma are from the epithelial cells, the mucous membranes. Sarcoma are those originating from the bone, the muscle. Lymphoma, like I mentioned to you, is from the lymph node, and leukemia is from the bone marrow or blood. So different cancer, different name, different treatment. Now, I think most of you may be aware already, cancer is the number 1 killer. 1 in 3, 30, more than, there's a lot of feedback. Not from my phone. 1 in 3 Singaporeans die of cancer. So about 30% of deaths in Singapore are from cancer, much more than heart attack, much more than infection. So as Singapore has become more developed, the rates of cancer has increased as well. About 14 people die from cancer every day and 28 people are diagnosed every day. This slightly older data is from 2010, but now the numbers are much higher. So top 10 cancers, males and females have different kinds of cancers afflicting them. For females, the number 1 killer is breast cancer, or at least the number 1 diagnosed disease is breast cancer. For males, it's colorectal cancer. So you see, colorectal cancer in females is also a very high number. Males, the second highest is lung, and number 3 is prostate. So later I'll focus just on the male cancers. On a different forum, perhaps there'll be other doctors who talk about female cancers. Now, the top 3, colorectal, lung, and prostate. But there are also many, many other types of cancers. But if you look at the rates, much higher for these 3 cancers. And I will just focus on these 3 first. So colorectal cancer, I think this is something many of you are very familiar with. It's not only common in males, it's common in females as well. And most patients are over 45 years of age. Some of them have risk factors, family members who have polyps or history of colorectal cancer. Personally, some of them, if they have this thing called inflammatory bowel disease, their risk of cancer is much higher. So that's why patients with this IBD, inflammatory bowel disease, they get scopes quite frequently. And finally, if there's family history, this could be genetic. And now, even in Singapore, we have tests. So if let's say there's someone in your family, first degree relative, brother, sister, or even your uncles and cousins who have cancer at a very young age, then they could have a genetic trait that some of you may have as well. So for this, there are special genetic tests and genetic screening, and NCC actually has a specialist here for that, who recently just came back from the US after training for a few years. So that's an area that's really developing, because now we know more and more some of these cancers may be passed down through aberrant or genes that are faulty. So you can see, even amongst those with one type of cancer like colorectal cancer, there are various stages. So this is something you need to know. For any type of cancer, there's this system called staging system. Why do we do this? This is so that we can tell patients, you are stage 1, your chance of cure is very high. And but you must undergo this treatment. While if you are stage 4, your chance of cure is low. So we will choose the appropriate treatment that will help prolong your life and not cause deterioration in your quality of life. So the focus is different. In early stage, the focus is cure. That means we're trying to get you rid of all the cancer cells in your body so that you can live a normal life. But if you're stage 4, it doesn't mean the end as well. Now with research and development, there are some new drugs that can not only prolong your life, but give you good quality of life, which for many years people have this misconception. They think cancer treatment means you lose hair, you get weak, you get tired, you die from the treatment. It's not true. Now we have a lot of supportive therapies, and we got new targeted therapy that cause much less side effects. In fact, the major side effect from all this is actually financial toxicity. Because cancer therapy is so expensive that it causes a lot of financial distress. But more than that, this technology has helped a lot of people in prolonging life and giving them good quality life. So staging is very important. So if there's a question you need to ask your doctor once you're diagnosed is, what stage am I? And what is my estimated 5-year survival? They use 5-year survival as a guide because it was something that people can maybe understand a bit better. So it was an arbitrary number. It wasn't research that 5 years should be the benchmark. Some of the cancers, if they survive very long, they even look at 10-year survivals or even longer. So lung cancer, we went a bit on colorectal, now lung. Lung cancer occurs mainly after the age of 40. And risk factors, I think many of you know very well, smoking. Some people get it because of inhalation at their workplace, either chemical, or in those days, people in construction industry or the shipyard have asbestos exposure, so they get this thing called mesothelioma. Symptoms-wise, they tend to lose weight, they get cough, and sometimes they even have shortness of breath. By the time they get shortness of breath, it's quite late. In the past, people didn't know this, so maybe up to 40, 50 years ago, although there was some research that showed smoking is bad, but people didn't really know very much because the smoking companies were very strong. They had a lot of advertisement, and it was very cool to smoke. Only recently, this has changed, of course, with a lot of intervention from the government, increased the prices of cigarettes, and also a lot of educational forums and information that clearly tells you cigarette smoking is very, very bad. Not just in causing lung cancer, it can cause many, many other types of cancers as well. So if you know someone who smokes or you smoke yourself, again, there are many places you can seek help from. There are a lot of smoking cessation clinics you can go to and ask for advice. There are also some treatment available to help you break the habit. Now, cigarette smoking among Singaporeans has been well studied, and what you can see is actually it's good news with all the treatments available to stop you from continuing this habit. You can see that the numbers have dropped from 92 to 98 to 2004. Everything shows a downtrend. However, in females, there's a bit of a reversal. Although overall numbers are lower than males, there was a rise in certain groups of females. So this, we are also trying to reverse right now. I guess with a lot of public health initiatives, this will hopefully change and lung cancer will drop. We know that. We have seen lung cancer rates are dropping, and we hope to sustain it. So I'm giving you an example of how even within one organ, there can be various subtypes. And each subtype, the treatment is different. So this is a major misconception that a lot of people have. They think lung cancer means all lung cancers the same, which is not true. Some lung cancers, the survival is very low, even if you treat them quite early. Other lung cancers, if you treat them, they can survive quite long, especially with some of the new targeted treatment that we have. So classically, it can be divided into small cell and non-small cell. Non-small cell are much larger in number, 90%, and within non-small cell, adenocarcinoma is the majority. But now you can see down there's this entity called EGFR and ALK. So this has only recently been discovered over the last 10 years. And we have specific medication, oral therapy that can target this. And with this new treatment, if you have this mutation, up to 70% response rate. Historically, last time with chemo, response rate is only about 20%. So it has improved tremendously with technology. So it's not one disease. These are survival rates. Again, now if you compare between cancers, it's different. Lung cancers, even stage 1, only 66% survival rate. 1A, the earliest, which is a very small nodule in the lung. if you recall back to colorectal cancer, stage 1, 90% survival rate. So different cancer types, different survival rate, stage for stage, because they behave differently. So it's important not to compare yourself or your loved one with some other patient with cancer, even though they are the same tumor type, or even different tumor types, worse still, very different behavior, very different survival. Prostate cancer is the third most common cancer, and it's so common that by the time you are about 60, 70 years old, nearly half the population out there have it in them. But is it important to know it? That is the question. Because prostate cancer, unlike lung and colorectal cancer, majority of it grows very slowly. So the reality is they have done many studies. They found that even if you pick it up early, it doesn't change your survival, because you unnecessarily get treatment and you put yourself through some of the side effects. Because prostate cancer, it grows so slowly that other comorbidity, other illnesses like heart attacks or cardiovascular diseases will kill you even before the prostate cancer kills you. While saying that, there's a small group of prostate cancer patients that may benefit from early findings of this, and I'll discuss this in a short while. Basically, they have urgency, that means the need to go to the toilet immediately, frequency, going very often to the toilet, nocturia, passing urine at night very frequently, and some patients may have a bit of blood in the urine. That's hematuria. So these are some of the symptoms that prostate cancer patients have. Diagnosing prostate cancer, we do a digital rectal exam. You go and see a doctor, they do a blood test for PSA, they do a digital rectal exam, and sometimes if that is suggestive of cancer, only then they proceed with a biopsy and other forms of scans. So what are cancer symptoms? Actually, it all depends on where the cancer is. So if the cancer is in the lung, for example, and you cough out, then you may cough out blood, or you may have shortness of breath. If the cancer is on your skin and it becomes an ulcer, it may be difficult to heal. Or if it's a mole, it'll grow suddenly. Normally it's stable, same size. One fine day, you realize it's growing. That's a sign, a red flag. You must quickly go and get it attended to, because it may be cancer. A change in bowel habit. Normally you go to the toilet to pass motion once a day, but now it's once every 4 days. And sometimes you have constipation, sometimes you have diarrhea, which normally you didn't have before. Then better get it checked. There could be an obstruction or a tumor growing inside. Change in voice, maybe something wrong with your vocal cords, or maybe a tumor or something growing there, a nodule. Most of the time it may be benign, but if you don't check, you won't know. So these are some of the common symptoms that people may have, and try not to ignore it. Go and see a doctor and get it checked. But there are risk factors that lead to you getting cancer, and this is important to know so that you can modify some of it. Of course, some things you can't modify. The genes you inherit from your parents, your grandparents, those things you can't change. But you can change the kind of insults you put your body through, like smoking, alcohol, things like that. I'm going to go through some. And these are the lifestyle choices or modifiable risk factors. So having a risk factor just means your risk of cancer increases as well. So the more risk factors you have, the higher the chance of getting cancer. But while saying that, of course, anecdotally, you may know some people, chain smoker for many, many years, many packs of cigarette. Why doesn't he get cancer? Then there are some ladies who have lung cancer who never smoked before. So my answer to this is, the person who's smoking who didn't get cancer and lived till maybe 70, 80 years old, if he didn't smoke, he may have lived to 120 years old. So if you want the bonus 50 years, then don't smoke. Okay, because sometimes you may have genes that are very good. Whatever insult you take upon yourself, the body still can withstand it. But if you didn't put your body through this, you'll have a much better quality of life. Because smoking, if you don't get cancer, you end up with COPD, and you can't breathe, and you struggle with daily living as well. So tobacco smoking, I'm highlighting this a lot because I think there's still some people, especially older folks, who smoke a little bit here and there, and it's the same whether it's cigar or pipe. They're all smoke that will cause cancer. So it causes many problems, as you can see. Cancer is just one of many, many problems. And cancer also not necessarily just lung. bladder cancer, pancreas cancer, all these are caused, esophageal cancer, all these are caused by cigarette smoke as well. And if you stop, some people say, I've been smoking 30 years already, what difference is it going to make now? It does make a difference. They found that as soon as you stop, within a year, your blood pressure will drop. Within 5 years, your cardiovascular risk drops significantly. Within 10 years, your risk of cancer also drops to something near the population, the normal population. So as soon as you stop smoking, apart from saving yourself tons of money, you also save yourself from getting a lot of these other diseases, which normally you are on track to get it, but it can be reversed. Now, the other thing I always tell patients, especially if they smoke in their home where the family is around, if you're not worried about yourself and you don't care about your family, because secondary smoke is a problem. I have a number of patients, females, whose husbands are chain smokers and they smoke at home. And then by the time they come and see me, the husband regrets, but you know, why regret? Stop now, straight away, you reduce the risk for your family members as well. Now, diet, I think diet is something that always comes to the forefront in our mind when we think of cancer, because there's a lot of information out there. Every Thursday you read Mind Your Body, there'll be some person saying that this diet is good, that diet is good, or you read any magazine, and after a while, if people get obsessed by it and they seek answers. Unfortunately, if you go and see a doctor, they'll tell you, I just eat a healthy diet, right? But what is a healthy diet? So most doctors, physicians will tell you that it encompasses a lot of vegetables, fruits, and less meat. But is there a specific diet that will help prevent cancer? I think what we know are diets that may promote cancer. So what are these kind of diets? High saturated fat. So apart from protecting your heart, if you eat low-fat diet, you also, in some extent, protect yourself from certain cancers, especially the hormonally driven cancers like breast cancer, prostate cancer, even colorectal cancer. So cut down on high saturated fats. The other thing is red meat. Red meat has been associated with colon cancer. I think the problem is sometimes when people take disproportionate high amounts of red meat, they don't take enough of vegetables and fiber as well. I don't know, for some reason, generally, meat eaters tend to eat less vegetables. I think there's so much your stomach can accommodate, and you apportion a lot of it to meat, then there's less space for the vegetables. And eating less vegetables can also increase your risk of colon cancer. But all these are population-based studies. That means they observe two different groups of patients, one who have colorectal cancer, one group doesn't have colorectal cancer. And then they look back and ask them, so what is your diet? And then those with colorectal cancer say, oh, I eat a lot of fried, oily, fatty food, a lot of meat, very little vegetables. Those without colorectal cancer tend to say, I eat more vegetables and fruits. So that's how these population studies have given us this information. But this is not the highest quality study. Of course, to have proof, 100% proof, we need to do controlled trials. But it's very hard to do when it's in relation to diet because you need large groups of people. So being overweight is an issue. The other thing is toxins. There's some toxins in diet. There's a mold that can be found in certain peanuts that release aflatoxin, which may cause liver cancer. So this is something you can obviously watch out for. If you see moldy peanuts and all, just be a bit careful. So healthy diet, I think you've seen this everywhere. If you go health promotion board or watch television when they have cooking or mainly nutrition-based shows, they will show you this food pyramid. If you understand this, maybe your bulk of your calories will come from your rice, that will be your staple, then vegetables in the middle, meat, and finally fat and oil right at the top. But now there are a lot of dietary fads. That means these are trends. People have read articles on, let's say, Atkins diet. They eat just meat and fatty food, not any, they remove carbs from their diet. So there are various forms of dietary fads out there. What I would recommend is read properly first. Don't go by hearsay. Read what are the pros and cons, and if you can, try to understand the scientific rationale behind it. The problem with dietary fads is the word fad. It's very popular for a period of time, then people run into trouble, and then later on they say maybe not a good idea. So this food pyramid has been there from time immemorial. everybody has been talking about this. You can't go wrong if you stick to this kind of food or this kind of diet. Now, UV exposure. Singapore obviously very hot whole year round, so a lot of sun. But the good thing is a lot of Singaporeans like to use umbrella even in the sunny day. So you protect yourself to some extent, but sometimes you can't protect all parts of your body. The other thing is when you drive, sometimes you also get certain parts of your hand and all exposed to sun. This can cause cancer, but you can take protective measures, use sunblocks with sufficient SPF or sun protection factor to reduce your risk to UV light, which can cause skin cancer. Fortunately, Asians have a low preponderance for this, but generally Caucasians have higher risk for skin cancer. So it's not just the environment, but could be some genetic factors as well. So skin cancers are quite low rates. Now, alcohol. So alcohol, we know, can cause cancers of the GI tract, especially the esophagus, the throat. It can also damage your liver very badly, and long-term liver damage can cause liver cancer. So this is an example. What happens is, if you can see on topmost, the top picture, sorry. You can see that this is a normal liver. When you have a lot of alcohol consumption, your liver becomes damaged. Liver nodules, the liver cells are quite peculiar. They don't regenerate into normal cells again. So they become nodules and they're not very functional. So you can end up with liver failure at this stage. However, in the long run, if it stays like this, it becomes liver cancer. So alcohol plays a major role in that as well. Infection, more and more as we investigate into the causes of cancer, we find that viruses can actually cause cancer. For example, hepatitis, again, because it causes cirrhosis, there's also some mechanism within the virus that drives the development of cancer. So hepatitis B and C can cause liver cancer. Human papilloma virus can cause cancer of the cervix. And this is why, for young females, there's a drive now towards getting them vaccinated. Because if you have a vaccine against HPV, human papilloma virus, then you are much less likely to get cancer of the cervix. The other common virus is Epstein-Barr virus. A lot of Chinese in Singapore, especially those from southern China, their families who were from southern China tend to carry Epstein-Barr virus, and they have nasopharyngeal carcinoma. Epstein-Barr virus is quite common among many people, but southern Chinese tend to develop nasopharyngeal carcinoma. So nose cancer is quite common in Singapore. Hep B virus, as I mentioned, certain chemicals. So sometimes, depending on what kind of job you do, some people may put themselves at risk for cancer as well. I've seen a few of my patients who work in printing press and things like that, where you got direct contact with dye, the chemicals that print. If they don't wear protective measures, gloves and all that, they may end up with bladder cancer or even lung cancer because they inhale some of these chemicals. So hopefully the Occupational and Health Safety Department looks into this and ensures there are safety measures in place. I know many of you are retired, but in the past, if there was such exposure and you do develop symptoms, you must quickly come and see a doctor just to make sure that it's not related or it's caused cancer. Now, I mentioned to you hereditary cancer. So about 5 to 10% of cancers are passed down from generation to generation. And this afflicts a lot of people, a lot of groups of families. So it's important for us to identify who these people are. So let's say someone has colorectal cancer at a young age. I think it'll be good for them to inform their family members that they have cancer. I think sometimes people are reluctant because they feel either ashamed or they feel fearful that this knowledge will cause a lot of sympathy and they don't want all these kind of things. But if it's your own family member and you got it at a young age and you think maybe or you're not sure, you think maybe there's hereditary cause behind it, ask your doctor about it. We have clinics that specialize in cancer genetics and we can test your family members. Now, therein lies a dilemma. So what if your family members know that they have this gene? Here I've written a few genes. BRCA1, BRCA2, these are the genes that have a high risk of a patient getting breast cancer. But if a male has this gene, your risk of prostate cancer is higher. So this is a gene that Angelina Jolie, the actress, had. And because of that, she removed her breast before the cancer developed. Because if you don't have breast tissue, you won't get breast cancer. Unfortunately, that is quite a radical approach. If you don't do that, then you must frequently go for checks if you have this gene, as early as you pick up the cancer. Because why did she do that? Why did she do such a radical step in removing her breast? Her chance of getting cancer was 80%. 80% chance that she will get, that's nearly surely she will get cancer. So the doctors advised her, you have two options. If you don't want to worry about it at all, remove your breast, then you won't get breast cancer. So she removed it. So that is one of the treatment options that are offered with patients with this kind of gene. The other option is close surveillance. That means normally we ask females above the age of 50 to do mammograms. In females who have this gene, whatever age they are, they have to do their ultrasound breast or mammograms in very close intervals. Because once cancer develops, and quite certainly it will, 80-90% chance, quickly you can operate. So they still get to keep their breast, but at some point they may risk themselves getting cancer. So why is this very important? The thing is, if you identify it in yourself, that means your family members are likely to have it. Will they want to know? How will this affect their insurance? I think now, maybe with MediShield Life, a few of these things may still be covered. In the past, it was a big issue. Even now, it's a big issue. If your insurer finds out, how will they react? They know you are nearly surely going to get cancer. So this is something that you have to think about. Second thing is, do you want to know? Because it means you may do drastic surgery, but it may save your life. So I think in balance, it's still better to know, but you may have to think of things like insurance and stuff like that before you do the test or embark on it. Because if you're already insured, by the time you get to know this, then it's not bad. You're covered. But if you do the test first, you find out you have the gene, and then you want to get insurance coverage, it's going to be very difficult. So that's some of the issues that you may want to think about if you have hereditary cancer, not the most common, 5 to 10%. So when you see a cancer geneticist, he or she will go through a very thorough family history. So this is how we diagnose that maybe the family has cancer. Sometimes different cancers are related. Doesn't mean your family member has breast cancer. If you have the gene, you will only get breast cancer. Like HMPCC, which is related to the colon. You can also get endometrial cancer. You can also get urothelial or bladder cancer as well. They're all linked to the same gene. So these are things that sometimes if you see a trend in your family, your cousin has cancer, your sister has cancer, even if there are different kinds of cancer, go and seek some advice from your doctor. It may be linked, and it means if you act early enough, you can pick it up. So cancer screening, I'm going to highlight this a bit because I think commercially a lot of companies, a lot of institutions out there, they say you must screen cancer, prevention better than cure. But cancer screening has its drawbacks as well. What is screening? Basically, it checks in a normal person, like people here in the hall, I'm sure many of you are cancer-free, but they basically do tests to identify if your risks of getting cancer is high. And then subsequently, if they pick it up early, you may get curative treatment. So the benefits, quite a lot. You improve your prognosis if you pick it up early. The treatment also may not be as severe. And in the long run, it's resource saving because you don't have late stage cancer, and you feel reassured if the test is negative. But there are a lot of disadvantages if the test is not a sensitive test. First thing is, like prostate cancer, for example. Let's say you found out you had prostate cancer, very early stage prostate cancer when you are 55, 56 years old. And at very early stage prostate cancer at that age, you potentially, if you don't do anything, just watch. In fact, that is one of the methods we treat patients is watch actively. Patients can survive another 15 years or 20 years if it's very, very early. And by that time, other diseases would have afflicted them. In that process, they feel anxious because they think, I've got cancer in my body, I'm a cancer patient, and it causes anxiety. Number two, they will make the doctor rich because every short while they got to go and see doctor consultation, and then the doctor will say, okay lah, do this test, that test. So doctors will become rich, and you become poor. And right, but it's all balanced, right? When you give money to someone, you become poor, the other person become rich. So, and the biggest issue is I have to stress is the anxiety. And the third thing is you'll be put through a lot of procedures, a lot of processes. You'll be given medication which you may not need because of the fact that you have cancer and you feel anxious. The doctor also feel anxious, they must treat you. Right? So, because otherwise you'll go to another doctor until you find someone who treats you. Because you don't understand. So even the doctor is doing the right thing. You come to, let's say NCC is a public subsidized center. Because you pay $30, you think, wow, this doctor lousy, $30. Must go Parkway, pay $200, then must be good doctor. So the $30 doctor say no treatment. Because the evidence shows for, let's say, early prostate cancer, there's no need for any treatment. But you feel anxious, you want it out of your body. Then you go in doctor's shop until you find someone who's like, okay lah, you really want to come on, I take out for you, you pay me money, no problem. Alright? So before you embark on that, you must think carefully. Why is this doctor saying no need? Is it because he really doesn't want to do the procedure? For us, it's very easy because we can just prescribe medications for some of these things and it's just type on the computer. But for us, the important thing is to do the right thing. To know that if the treatment is not useful, we won't recommend it to you. So sometimes you must look at why is he saying I don't want to treat you. Because it's always easier to treat. But to explain to a patient not to treat, it takes a long time. Yeah, so sometimes I spend a long time and then at the end the patient says, wow, this doctor still don't want to treat me. So sometimes you must put yourself in the doctor's shoe and wonder, why is he saying no? And then when he explains, try to understand and go back and research it. And I think in this group, for you to be interested enough to come here, you are the guys who are interested to find out, is this necessary or not? Always question. And if you're not happy, get a second opinion, but don't decide on the treatment yourself and then go and choose the doctor who's going to give it, because there will be a doctor who will give it. For any amount of money, there will be people who will do things, right? So that's something you've got to think carefully. So I'm going to go through some of the screening tests where there's evidence. So first, colorectal cancer. There's evidence because there are very high incidence rates in Singapore. If you're 50 years and above, they recommend a simple test you can do in your GP, fecal or cut blood. Pass them a bit of stool, they test to see if there's any blood inside. This one you can do yearly once you're 50 years and above. But if you think very mafan, every year must go and pass some stool, then you can do a sigmoidoscopy, right? You can go and do a scope once in 5 years. If it's clear, good. Or a colonoscope, a bit more costly, but you do a full scope once in 10 years. If you don't have, then 10 years later you can repeat. So these are some of the screening tests that can be done. For women, the two things we recommend are cervical. For cervical cancer, pap smear. So pap smear, once you're sexually active, every 3 years once you should do a pap smear. But now with a lot of young patients getting the vaccine, they probably are protected. So this may change. Many of them may not be getting cervical cancer, but pap smear advised once in 3 years. Breast cancer, again, this has come with some controversy recently. There are some that say that mammogram, you don't need to do it so frequently. Our advice is once you're 50 years old, every 2 years, maybe you can go and do a mammogram. It's uncomfortable, it's painful, but if your risks are a bit higher, you have some relatives with breast cancer or something, it's very good for you to do it. Otherwise, if you don't as well, if you can do self-breast exam, some studies have shown it's not very effective because most people can't feel it by themselves if they're not trained properly. So better see a doctor, get a full breast exam and a mammogram. All these things can be done in your polyclinics. So don't have to specifically go to a commercial center. The waiting time may be a bit longer, but it can be done in a cost-effective manner. So I went through the screening. So for prostate, so I focus a bit more on prostate. I'm actually a prostate cancer doctor. I treat urological cancers. So prostate is one of my areas of specialty. And mainly a lot of men get it. It's number 3 in Singapore. Why? Because many years ago, up to maybe 2010, there was always a prostate screening drive. Free PSA screen and exam. They were advertised in the papers. At the time, we didn't know better. So everyone was screened. People were all, running to SGH or Changi or wherever they have free screening, quickly get it checked and then find out whether they have prostate cancer or not. 2010, there were 2 big studies on hundreds of thousands of patients. One was in US with over 80,000 patients, and then one more in Europe, 160,000 patients. And both the studies were conflicting in their results. The one in US, they found prostate cancer screening does not save lives. So what they found is you get overdiagnosed, you unnecessarily do a lot of tests, at the end make yourself anxious and remove your prostate. And by virtue of that, it's a lot of problems. Prostate cancer surgery is quite big. Number two, you also end up with problems with incontinence, impotence, so a lot of your normal functions get affected as well. So whether you need to do it or not is a question that a lot of people are uncertain of the screening part. Because even if you find it, what are you going to do? If it's early stage, you may not need to do anything. That's number one. Number two is, when they did it in Europe, it was a positive test. But they found you need to screen 1,200 patients in order to save one life and treat 50 patients for one person to increase or to save one life. That means 49 patients will not die but get treated unnecessarily. Right? So there's overdiagnosis and overtreatment in prostate cancer. So prostate cancer, the Singapore guidelines, I'll show you in a while. I think it's not here. Oh, this is the Singapore guidelines actually. So if you're high risk, like African American men, you have high risk, then they should be screened. But for men who are younger than 50 years old, it shouldn't be offered at all. When they're above 50 to 75, and their life expectancy is expected to be high, actually, you can actually in some ways predict your life expectancy based on life tables. There's this thing online, even for Singaporeans, where you can go and then check and see for your age at this point in time, on average, how many more years are you expected to live on average? So that gives you an idea of whether you should do it or not. If let's say you're 70 years old and your life expectancy is only another 5 years, and prostate cancer, if you diagnose it early, you will live 10, 15 years. So what's the point of finding out if you've got prostate cancer? Better just enjoy your 5 years. Otherwise, that 5 years you have left, you'll be unnecessarily cracking your head, going around telling people, I got cancer, I'm going to die. Then after 75 years or so, people are waiting for you to die, so you're not dead. I got cancer, I'm going to die. Now, so prostate cancer, sometimes you can survive many years. So how you decide, number one, what is your current age? What is your expected life expectancy if it's not very long? Because I have patients diagnosed prostate cancer, 80 years old, they got heart problems, stroke, bedridden, and then don't know what reason the doctor went and do PSA and then now found out about prostate cancer. And their life expectancy is only maybe 1 or 2 years more. So I'll tell the family, don't treat, don't give anything. Because already they have so many medications, why burden them with more? All these treatment, any treatment you must understand, sure got side effect. Panadol also got side effect. Okay? The only reason why we take it is sometimes the benefit exceeds the cons or the cost. That means you will get more benefit from taking it than the side effects. But if you don't have many symptoms, then why take something that's going to cause more harm? Right? So choose very wisely when you want to do it. Ask your doctor first. If you've got family history, your brother has prostate cancer, your uncle has prostate cancer, your father has prostate cancer, then maybe you should do it. Because it's quite strong in the family. And second thing is, if they have aggressive prostate cancer, out of 100 cancer patients, 90% the cancer will not, prostate cancer won't be aggressive. But the 10% we don't know who. So if you have risk factors, then you should get it checked. Because this 10% prostate cancer can grow very fast. So when you go to, let's say, a clinic, sometimes they'll say, do tumor markers. Don't worry, very cheap. If you do just blood count and liver function and kidney, is $80. You add another $5, we give you all the tumor markers. Don't do because you will inevitably find one of it will be raised. What does it mean if it's raised? None of these tumor markers are accurate in predicting whether you have cancer. Sometimes we use it as oncologists after you have cancer. That means it's raised when you have cancer, and we use it to trend to see if you're responding to treatment. But even then, it's not accurate. So some patients become very obsessed. So again, I give an example of prostate cancer. They use PSA. So with those who have prostate cancer, if PSA starts rising, they get very worried. But there are many studies that have been done. If it rises, it doesn't mean you got more cancer cells. That's why if it's rising, the first thing I do is I scan them again. And then I show them, look at your CT scan. It's not growing. The PSA is going up. Because sometimes a few cells can release a lot of PSA. Sometimes I got patients, cancer all over the body, PSA low. So it's proof that these markers are not effective. Worse still, if you're a normal person and you go and do it, you unnecessarily will stress yourself out. Because, for example, CEA, if you test it randomly in the clinic and it's raised, and then the doctor tells you, you get worried, then the doctor says, I'll refer you to a gastroenterologist. Gastroenterologist say, okay, I think better scope. So scope up, scope down, then can't find anything. So undergo pain, suffering, pocket become lighter. Right? So and then at the end, the doctor says, okay lah, all clear. So all this and the anxiety by the time you get appointment, go and see the gastroenterologist, all that anxiety plus the risk, doing scopes is not zero risk, you know. People can get perforation. They put in, because it's a tube that's going into your bowel. The bowel wall is very thin. They accidentally poke out of the thing, you'll perforate, you can die from this. And sometimes it's not explained to you clearly. Only after when the problem starts, then it comes out in the papers, doctor never tell me. Right? Then at the end, find out no cancer. Right? So CA can be raised from smoking. So if you're a smoker and your CA is raised, most likely it's from the smoking. So some of these tests, there's good guidelines and evidence that you shouldn't simply do. So if the doctor offers it to you, say you only add another $5, say it's okay lah. I don't have any symptoms now, you don't go and come and give me more problems. So screening tests must be done carefully, selectively by a doctor who knows your risk factors. So if you have risk for some of these things, then choose and do it. Otherwise, don't do it. So it should not be used alone as a screening test. Now, lifestyle advice, this is, I guess, the hardest part. Because all the best things in life seem to be bad for the body. So you have to choose what you want to do appropriately. Unfortunately, a lot of people, when they're younger, they think they're invincible. They can take on the world, everything they can do. So by the time they grow older, when things stop working, they feel regretful. But lifestyle change, whatever your age, will make a difference. Even if you have cancer. So there are some studies that show that if you have cancer and you start, let's say you're on chemotherapy or some toxic drug, if you're strong enough, if you feel good enough, with some of the new targeted therapies, people will go back to work. Those who exercise survive longer than those who don't exercise. So it doesn't mean when you get cancer it's too late, I shouldn't change my lifestyle. But unfortunately, those people who do change lifestyle is only after they get cancer. Right? So the key thing is to change it before you get it. So how can you reduce it? These are all guidelines that you find everywhere, very common. Engage in physical activity. Many years ago, it was just 3 times a week. Now the general advice is you got to do something vigorous enough to increase your heart rate. It doesn't have to be running or cycling, even walk, brisk walk, for at least 30 minutes, 5 times a week. So 30 minutes sustained activity helps reduce your cardiovascular risk. And by virtue of that burning some calories, you reduce risk of obesity and risk of many of the cancers that have been shown. Okay, so if there's an opportunity for you to walk from MRT to a certain place instead of cab, or I know it's very hot, but you know, if there's any opportunity to do exercise, unfortunately, some patients take it that if they feel tired at the end of the day, it's exercise already. I'm a housewife. Every day I cook, I wash dishes. Exercise what? What else is there, right? Or I do gardening. My hobby is gardening. What kind of brisk walking do you do in gardening? You sit, squat in one spot and chankol and plant, right? It is exercise, but you don't burn as much calories. Your heart rate doesn't go up to a rate where it's going to be helpful for you, right? So eat healthy. Again, 5 servings of vegetables, fruits. Cut down salt. So this advice, if you think about it, very similar to the advice given to heart patients. So heart health is also good for cancer health as well. Okay, choose your food wisely. So just briefly on some cancer development, normally if you have early stage cancer, the main treatment of choice is surgery. By removing the cancer from your body, there's very low risk of you having any more cells. Unfortunately, sometimes microscopic small cells may have spread and hidden in other parts. CT scan cannot pick it up. And that's why we worry about recurrence. So for some cancers like lung cancer, after surgery, on the scan you're clear, we advise chemotherapy. Then the patient asks why. The reason is lung cancer is so aggressive, some small cells are hiding elsewhere, micrometastatic cells. And the chemo will go and kill those cells. So your risk of recurrence reduces. Okay, and we can also use radiotherapy, but one big part of cancer care is actually psychosocial support. Patients who are undergoing cancer, they will have a lot of emotional distress, mental distress, and financial distress as well. Many ways, I think there are financial help available, but with the newer therapies, unfortunately, there's very little help. So sometimes we may need to use other drugs that are cheaper. Hopefully in the future, with better insurance coverage, this may not be an issue. Now, what I mean by new therapy, last time chemotherapy is like a cluster bomb, it's like a nuclear bomb that come, kill 200,000 people, and then not just the bad guys, even the good guys, women, children also end up getting killed. Now, the therapy is a bit better. It targets more of the cancer cells, less of the good cells. What are the good cells? Like hair, for example, right? In the old therapy, you will have a lot of hair loss. You have other things like, weakness, tiredness, joint pain. Now with the newer therapies, you may have some of that, but the peripheral effects are less. You won't get, in fact, many of the targeted therapies, no hair loss. Although some of it is slightly different. Some of the new therapies may turn your hair white. In fact, there's one therapy I use in kidney cancer. My patients love very much, especially the females. Your skin becomes very smooth and white. And then many of them, their friends will ask them, what treatment you use? And then they tell them, oh, kidney cancer treatment you want? But then the answer is no, nobody wants kidney cancer. But the new therapies have a different side effect profile, right? So times have changed. Here you can see somebody with lung cancer, and these are cancerous cells. This is the heart, this is the heart, this is normal. These are the cancerous cells, these 3 real. Then 4 months later, very quickly, they can actually disappear if you have the mutation. So nowadays, we've gone into molecular cytogenetics. We do not just look at what are cancer cells, we go deep into the cells, we sequence the DNA and find out what is the mutation, and we have a drug that specifically targets the mutation. So I mentioned prostate cancer. So colorectal cancer also, the main treatment is surgery. Stage 4, we give palliative chemo. Palliative chemo means chemo that can prolong your life, hopefully also improve your quality of life, but it may not cure you. So finally, there's some take-home messages. Make the right lifestyle choices. Choose your screening test wisely. If people have products they want to sell to you in terms of blood tests, ask carefully first what are the things being tested, and ask whether there's a need to do those tests. And if you're newly diagnosed or caring for someone, always try to seek more information, because cancer care has become quite complicated with new therapies, and you want to make sure you are getting the best. And the good thing is, in Singapore, even in NCC, a lot of people have misconception. Government hospital means don't have. Actually, we have all the things that the best cancer center in the US has as well. Even better some of the times than some of the private centers. So it's always good because we have access to clinical trials. Some stage 4 cancers, the chemotherapy that's available outside or even in any center may not be the best because they can't cure you. But clinical trials give hope. In fact, in the US, many patients come to the top government or university cancer centers because they are the ones with the new drugs that can revolutionize your cancer therapy. And in places like NCC or even NUH, we have the best therapy in terms of clinical trials. So that may be an option, especially stage 4 cancer. So with that, this is our cancer helpline. Next week, we are organizing a talk. One of my areas of interest other than prostate cancer, because I treat a lot of old patients, is cancer and older cancer patients, those 65 years and above. And specifically, there are actually techniques to assess them to see whether they are fit for treatment or not. Because nowadays, 65 years old is different from 65 years old last time. Last time, 65 years old, you're near death already. That's the lifespan. 30, 40 years ago, maybe your parents' time, when you hit 65, you're like, wow, you're so old. That time, retirement was 55 years old. Right? So now, retirement is going higher and higher. 65, you are just starting your retirement. And by virtue of that, you shouldn't use age to decide whether a patient needs treatment or not. You should use your actual physical fitness. Now 65 years old, you're marathoners. You're people climbing mountains, jumping off planes, right? So this talk focuses on how, for older cancer patients, there are actually new techniques to choose who's a fit patient who can receive treatment and who's not. Last time, even now in many places, you walk into a clinic, the doctor will look at you and say, oh, you can walk. Okay, we try cancer treatment, because they think you are fit, but internally you may not be. While there are other patients who may come in, may look a bit frail, but actually they are much fitter. So there are some techniques in selecting patients like that. And I've managed to get 2 of my colleagues from overseas. These are very renowned people. who are coming for a conference. So I thought it would be a good opportunity for the public to also listen to them. So this will be next weekend. If you're all free on a Saturday, you can come by. Thank you very much.
Thank you, Dr. Ravi. We'll now be taking questions from the floor. Do we have any questions from the audience?
Dr. Ravi,
Yes.
like for me, the part where fiber, vitamin, and mineral
Yes.
on your
In the slide.
yeah, on the slide.
Yeah.
Can you do that for me, please? I'm sorry. On fiber, vitamin, and mineral. What do you mean on the mineral?
Okay, so in terms of fiber, what I mean is your portions of vegetables and fruits. So that's got high fiber content. If you can't eat, then there are supplements for that as well. In terms of vitamin mineral, so this is an area where a lot of times you have questions because there's information out there. This vitamin is good for what cancer, and should I take multivitamins? There are other supplements, also herbs and all that. All I can say is they have done many trials on specific vitamins. Last time for prostate cancer, I always use that as an example, that's my area of interest. They thought vitamin E and selenium was very good. So they actually did randomized trials and they found that there was no difference in cancer prevention. So vitamins and minerals may be overall good for your well-being. You may feel better because vitamin B boosts your appetite. You may have that feel-good thing. Unfortunately, none of these vitamins have been shown to prevent cancer. So don't overdo it. Just take what is recommended. Most of the time, if you have your food pyramid, you know, the right amount of vegetables, 5 servings a day and all that, you should actually be fine. So with regards to whether you need supplementation, it will depend. If you have a very poor diet, you don't eat your meals regularly, you don't eat a lot of vegetables, then maybe you can take a multivitamin. But in terms of cancer prevention, unfortunately, many big trials have been done and they have not found any benefit. The good thing is sometimes for certain vitamins, too much of it may just be washed out in your urine. But for some, like vitamin A, too much, or vitamin E generally not a big problem, but vitamin A may be bad for some organs of the body. So choose your vitamins. The general multivit can be added on, but for other diseases though, things like fish oil with omega-3 fatty acid or vitamin E and all may help, like cardiovascular disease. But for cancer prevention, unfortunately, none of these vitamins in big clinical trials have been shown to be positive. Yes?
Sorry, on vitamin D, what does that vitamin D, and the fiber of breast cancer, with the NCCS, I just want to know what is vitamin D?
Vitamin E, yeah.
For the calcium.
Oh, D, vitamin D, yeah, it's for the bone. It's for bone. So breast cancer, prostate cancer patients, they tend to have cancer spread to the bone. That's one problem. Prostate cancer patients, similarly breast cancer patients, their hormone levels are low, so their bones become osteoporotic. So we recommend they take vitamin D plus calcium. Why? Because calcium alone will not be absorbed without vitamin D. The good thing is, if you're out in the sun, you get sufficient vitamin D through your skin. So, but a lot of people don't like the sun, very hot. So they have combination tablets which has both in it, and that's probably what you have been put on. Yeah, so it's for bone health.
Thank you, Doctor. Greatly appreciate.
You mentioned chemical just now. Can you comment on chemical commercial AI?
Oh, commercial AI, very common question. So, as of now, I don't know of any strong studies that say you shouldn't use it. Although, when you start chemotherapy and all that, we will try to tell you to avoid. The reason is hair dye, it doesn't just stay on the follicle, some of it gets absorbed into the bloodstream. And we don't know how this may interact. So that's the general advice. But there's no hard proof that that can cause cancer. Yeah. But if you're on chemo, then we'll say don't add on more chemicals. Same way with TCM as well. It's not because we think it's bad. We just don't know how it interacts with your chemo drugs. So there are many TCM practitioners out there who say this is good to support your immune system, so you can take it together with chemo. Unfortunately, we don't have studies to prove that. So in some patients, my concern is if the TCM is processed in your kidney and liver, the chemo is also processed in your kidney and liver, it will overwhelm the system because it's limited capacity. And if you stuff too many things to be processed, then you end up in trouble. Number two is sometimes certain drugs will release an enzyme from the liver which will reduce the effectiveness of the cancer. therapy. That means you take TCM, it releases this enzyme, the chemotherapy concentration in the blood drops. Then you don't get the good benefit of it. Conversely, the chemotherapy level in the blood increases because of this enzyme, a different kind of enzyme that is stimulated by the TCM. Then you get toxic effects that are worse than if you didn't take it. So the general advice, if you are on, especially if you are on curative treatment, that means we are aiming to cure you with the chemo, do not take anything else. Not even, there's so many things, placenta, human placenta, soursop, and then the TCM one like lingzi and all that. So there's so many different components. They are still trying to study to see how this may interact. For now, we don't have enough information. So if you're going to be cured by the chemo, you don't want to mess with the other things that may make it worse. Yes, sir.
Cancer marker.
Yeah.
So if it is so-called so very ambiguous, why didn't it stop put it like just like I mentioned, for those below 50,
yes,
you don't offer the
So you see, the offering is not by public institutions, it's all commercial entities. If you go to any polyclinic or even NCC, actually we used to have a cancer screening clinic up to 2010. Then when we got a lot of this information, we thought it's not ethical. Because initially we thought, okay, so many people, they have all this executive health screen, the company sends them free, might as well do, right? So when they send them to a private clinic, the private clinic will do all these tests. NCC used to do it as well. Then later we realized this is not ethical because there's no evidence to support. Unfortunately, when it comes to government, enforcement, there's nobody who really puts their foot down and says, all these private entities should stop. But same like any other industry, there can always be more regulation. Yeah, so on my part, it's my responsibility to tell you what is evidence and what is correct. Because you all have been interested enough to come here to listen, so I must give you the correct advice, you see. But I'm not incentivized in any way to do these tests. But people who are, if you go to a different talk in let's say outside the private hospital, then you must always question, why is he telling this? Who stands to gain if I do this test? Now, because sometimes you must be skeptical. Unfortunately, medicine, just like many other industries, it's been commercialized. So it's for profit. So
coming back to this PSA measurement,
yes.
What is the significance of it?
Significance of PSA. So in screening,
yes,
they find that if you have risk factors and you choose to do screening, then they not arbitrary, but they have a cutoff of 4, where above 4, then your risk of having cancer may be a bit higher than the normal population. So they'll suggest you do a biopsy. That means they'll first examine you first. If they think your risk is higher, to do biopsy. The significance is PSA is released by the cancer cells. But sometimes normal prostate cells can release, but they won't release as much. So some patients may have benign prostatic hyperplasia. A lot of males have it, much more common than cancer. That's why they have difficulty passing urine around. But it doesn't mean they have cancer. It's when they get old, the prostate becomes enlarged, but it's benign, it's not cancerous. In fact, cancer less likely to cause those symptoms. Because if you think of prostate as a cylinder and the tube in the middle where you pass urine, cancer grows on the outer part. So it must be very big cancer to compress on the tube. But the benign prostatic hyperplasia grows from the middle. So that one also releases PSA, but not as much as cancer. So we use that as just a rough guide to assess your risk of cancer in screening, but it's not accurate.
Is there any cutoff point that you must do for treatment?
No, so no cutoff point for treatment. But if let's say it's above 4, then you may have, we'll refer you to a urologist and they'll do a biopsy. But in the first place, you must think carefully first. Do I want to do it? Do I have symptoms? Do I have risk factors? What's my estimated projected survival? Do I want to know? And if you're not sure about this, it's okay because it's confusing. There's a lot of data. Go to your doctor and ask. Most of them should be aware of some of these guidelines. So then they'll tell you, if I do for you, are you prepared to accept this? If it's positive, you will end up with a biopsy, which is painful. And biopsy sometimes, because prostate is a very weak organ, they go in through your anus, the rectum, and they do a biopsy with many needles. There's risk of infection, bleeding, and you may not get the cancer, because cancer may be in one spot. The biopsy may be in another spot, so you may be negative. So if the doctor explains to you like this, and you say, yes, I'm willing to take all these risks of these procedures just to find out And if I find out, then later I'll decide whether I want treatment. Then it's okay. Then you can do the PSA screening.
Like my case, I went for a biopsy because they use a magic finger, and then they found that the thing's hard.
Yeah.
So I went for a biopsy.
Negative.
But the biopsy is clear.
Yeah.
But now the PSA, sometimes it fluctuates. So
If you're well, you don't have symptoms, and the biopsy is negative, if you think the PSA rises again, they can try again. I said, like I mentioned, there's a risk the biopsy didn't hit the cancerous area. So it may be in somewhere, hiding somewhere else, so it may be there. But if the fact that you don't have symptoms now means it's a very slow growing cancer in the first place. So if you can get it off your mind that even if it's there, it's not going to cause problem, then you can lead your normal life, it's fine. But if it gets you very anxious, then the urologist, if they search hard enough, maybe they may find something, but no guarantee. And in the process, every few months you'll be doing all these procedures. So you must know the pros and cons. At the end, you have to make that decision, you see. The doctor can give you advice, tell you what are the costs, what are the benefits, but the choice is yours. Okay, one more last question. Sorry.
Recently, I think during the colorectal month,
Yes.
I sent 2 samples. So these FOBT tests.
Yes.
And the result came back as one was positive. Okay, and well, that's one thing. Another thing is I noticed there has been a significant change in bowel habit, which is one of the signs of cancer. You know,
Yes.
Not so frequent, maybe once in 2 days, 3 days. Another observation is by 1 year as becoming sort of there's more loss of hearing, and which is listed as one of the symptoms of cancer in this small slip there. So, with all these observations, am I a potential candidate for colorectal cancer?
So, unfortunately, I'm not Superman, can see through your body. But see a doctor, most likely they recommend a scope. The hearing may not be related, but all this can get checked up. So the key thing is to see your doctor. They'll explain to you that your risks are like this. You should get a scope, and then once you get that, everything negative, you can sleep in peace. Otherwise, every Saturday you'll turn up here and you'll ask a different doctor who will give you the same answer.
But then if you find a positive result in a FOBT test,
It's not accurate, so it's not 100%. A lot of patients who have screening positive may still be normal. It may be from PALS. PALS also can give you a positive FOBT test, which is very common. A lot of people have PALS. So more often than not, a positive test may actually be negative for cancer. So if you're uncertain, go see a doctor, and then they'll be able to, even if you go polyclinic and you tell them you have this test, you show them the result, they refer you to a gastroenterologist. All right, thank you very much.
Ladies and gentlemen, please kindly remain seated. Please join me in thanking Dr. Ravi for sharing some knowledge with us regarding common cancers affecting. Ravi shared just now, we'll be having a public forum next Saturday on geriatric oncology and new standard of care for older cancer patients. You can call us next Monday from 8:30 a.m. onwards to register at the cancer helpline. It's 6225-5655. Please kindly fill in the evaluation form and please exit from the door on your left or from the back. Thank you.